Hello everyone, today we discuss about helical structure of DNA and its uses in medicine. The discovery of the double helix half a century ago has so far been slow to affect medicinal practice, but significant transformation are likely over the next 50 years. Changes to the way medicine is practiced and new doctors are trained will be required before potential benefits are realized. It is much more important to know what kind of patient has a disease than to know what kind of disease a patient has. Calipari, 18th century physician, Bath. The structure of DNA established in basic framework that would develop into the field of molecular genetics. The information gleaned from the scientific endeavor continues to have a profound influence on our understanding of biological systems, as most human diseases have a significant heritable component. It was soon recognized that the characterization of genetic determinants of disease would provide remarkable opportunities for clinical medicine, potentially altering the way disease was understood, diagnosed, and treated. But despite the obvious potential application to medicine, the development of significant genetic advances relevant to clinical practice could take generations. This is in marked contrast to many other medically related uh, discoveries that occur around the same time and which were translated rapidly into clinical practice. For instance, the development of penicillin by Ernst Chain and Howard Florey in 1941 was saving thousands of lives within months of their discovery of how to efficiently produce the antibiotic. Discoveries relating to disease etiology, such as the recognition of in 1950 of relationship between smoking and lung cancer, have had a distinguished statistical geneticists who argue against the causality of the observation, implying that a common genetic factor causes both lung cancer and uh, predi- predilection of to smoking cigarettes. Although other important discoveries have had demonstrably more impact on healthcare at the time of their 50th, 50th anniversary, that has the double helix. Its slower transition from discovery to clinical implementation will be balanced by its own potentially profound impact across all medical disciplines. Progress has been slow, but mounting evidence suggests that while public health and antibiotics produce important healthcare outcomes in the past 50 years, the next 50 are likely to belong to genetics and molecular medicine. The potential impact of genetics on clinical practice has been questioned by some observers who believe that the positive predictive value of genetic testing for most common disease genes will be sufficient to provide the beneficial effects seen with single gene disorders which affect only a tiny proportion of the population. Many advocates of genetics argue, on the other hand, that our understanding of disease is undergoing a major change. They contend that genetic research is playing fundamental role in improving our understanding of the pathophysiology that underlies disease, and that inevitably, as disease apply, it will alter both and the theory and practice of medicine in the future. A new taxonomy for human disease. Clinical practice has always been limited by its inability to differentiate clinical, biochemical, and pathological abnormalities that accompany a disease from those events actually responsible for meditating a disease process. Clinicians may have moved on from calling fever a disease, but they still rely on phenotypic criteria to define most diseases, and yet those may obscure the underlying mechanisms and often mask significant heterogeneity. As Thomas Lewis pointed out in 1944, diagnosis of most human diseases provides only insecure and temporary conceptions of the main common diseases, only the infectious diseases have a truly mechanism based nomenclature. An understanding of the genetic basis of maladies is providing a next taxonomy of disease free from the risk that the diagnostic criteria related to events are secondary to the disease process rather than its cause. Genetic information has allowed us to identify mechanistically distinct form of diabetes, defining an autoimmune form of the disease associated with human leukocyte antigens, a highly diverse complex of immune system genes, and recently has implicated dysfunction of factors that affect both the expression and modification of gene products in mediating the adult form of the disorder. Similarly, we are now aware of a range of molecules and pathways previously not recognized in the pathogenesis of asthma. A clearer understanding of the mechanism and pathways that mediate disease will lead to the definition of distinct disease subtypes and may resolve many questions relating to variable disease symptoms, progression, and response to therapy seen within current diagnostic categories. Ultimately, this may provide greatest contribution genetics will make to clinical practice, a new taxonomy for human disease. Knowing that a disease can arise from a distinct mechanism will alter a physician's approach to a patient with that disorder, allowing a more accurate prognosis and choice of the most appropriate therapy. The mutations responsible for many single gene disorders are now commonly used in diagnostic practice, whereas those associated with common complex diseases are just being characterized, although their predictive value will be less than um, with single gene disorders. Their contribution at risk factors will be similar to other risk factors such as blood pressure, cholesterol levels, and environmental exposures. Because much of clinical practice involves evaluating and acting on risk probabilities, the addition of genetic risk factors to this process will be an important extension of existing practice. The overall effect of genetic risk factors is likely to be significant. For example, recent estimates in breast cancer suggest that the attributable genetic risks are likely to exceed the predictive value of range of existing non-generic risk factors. Okay, thank you.